So I'm gonna go ahead and say it because I know nobody gonna say it, but I'm gonna say it. Black women, we need to lose weight. I'm sorry, I said it. We need to lose the weight. Let's talk about something serious. Cancer rates are on the rise, and one of the biggest risk factors, obesity. You don't hear about this enough, but the research is clear. Excess weight is now one of the strongest predictors of developing certain types of cancer. And the group most at risk, Black women. This is a conversation that isn't happening nearly enough. So today we're breaking down the data, the science, and most importantly, what you can do about it. We've known for years that obesity is linked to heart disease, but now research is showing obesity is directly connected to at least 13 different types of cancer. According to American Cancer Society, being overweight or obese is responsible for about 40% of all cancers diagnosed in the United States. Let's break that down. Endometrial cancer, uterine cancer. Women with obesity are twice as likely to develop this compared to the healthy weight to women, their counterparts with healthy weight. Breast cancer, postmenopausal women. A study in the Journal of Clinical Oncology found that women with obesity have up to 58% higher risk of developing breast cancer after menopause. Colorectal cancer, a study published in Cancer Epidemiology, Biomarker and Prevention found that obesity increases colorectal cancer risk by 30%. Liver, kidney, pancreatic, ovarian, all linked to excess weight as well. This isn't just about numbers. This is about real people's lives. And when we look at who is mostly affected, it's Black women at the highest risk. I know this personally. My mom has cancer. My grandmother have cancer. So cancer is very personal for me. According to the CDC, Black women have the highest rate of obesity in the US. Nearly 60% of Black women are classified as obese. 60. This is not just about lifestyle. There's a deeper systemic, cultural, and genetic factor at play. Number one, hormonal and metabolic differences. Research shows that Black women are more likely to have higher insulin resistance and lower metabolic flexibility, making weight loss more difficult. Higher levels of chronic inflammation increase cancer risk. Two, access to healthcare and preventative screening. Studies from the American Journal of Public Health shows that Black women are less likely to receive early screening for cancers like breast and colorectal cancer, leading to later stage diagnosis and poor outcomes. Chronic stress and cortisol level. Chronic stress from racism, social economic challenges, systemic inequality have been shown to increase cortisol levels, which directly contributes to weight gain, particularly around the abdomen. It's that belly fat, ladies. Black women's health studies found that chronic stress, discrimination were strong predictors of obesity and metabolic disease. Dietary and environmental factors. Food deserts and lack of access to healthy, affordable food lead to higher consumption of ultra-processed, higher calorie foods, environmental toxins, endocrine disruptors, lack of culturally competent medical care all play a role. When you combine all of these factors together, the result is significantly higher risk of developing obesity-related cancer than anyone else. This isn't about blame. This is about taking back control. So what can we do? Weight loss. Number one, as a cancer prevention strategy, losing even 5 to 10% of your body weight has been shown to significantly lower cancer risk. A 2022 study in JAMA Oncology found that women who lost weight had 26% lower risk of developing obesity-related cancers. Two, GLP-1 medications as a tool for prevention. Weight loss medications like semaglutide, which is the Ozempic and Wegovy, and tirzepatide, which is Mounjaro and Zepbound, are changing the game. If you struggle to lose weight your entire life and you can't figure out how to do it, this is the way. These meds reduce insulin resistance, lower inflammation, and help regulate hunger hormones factors that also impact cancer risk. Prioritizing cancer screenings and early detection. If you are a Black woman over 40, make sure you're getting the mammogram. Make sure you're getting a colonoscopy. Make sure you're doing the routine screenings. If you have family history of cancer, like I do. Talk to your doctor about getting screened earlier. 4, targeted nutrition and exercise strategies. Anti-inflammatory diets rich in whole foods, fibers, omega-3 can help lower your risk of cancer. Strength training is particularly important. Muscle mass helps regulate insulin sensitivity, reducing cancer-promoting inflammation. 5, advocating for better healthcare access and research. Black women are underrepresented in medical research. We need better studies, better care, better access to life-saving treatment. This is a wake-up call. Cancer is not just about genetics, it's about what's happening in our bodies right now. And obesity is one of the biggest modifiable risk factors we have. The numbers don't lie. I'm not making up these numbers. This is facts. These are statistics. This is real. If you want to argue with somebody, argue with yourself. Don't argue with me. The numbers don't lie. All right. Black women are at the highest risk, but they also mean Black women have the most to gain from taking action. So here's what I want you to do. Drop a comment below. What surprised you most about the connection between obesity and cancer? 2, share this video. More people, especially Black women, need to hear this message. 3, make sure you subscribe because I'm going to continue breaking down the real science behind weight loss and health. This is about more than just weight. This is about fighting for your health, your longevity, and your future. I'll see you in the next video.